For the record, my name is Haiti Tadros, and I am the Director General of the Directorate of Nuclear Cycle and Facilities Regulation. With me today to respond to any questions the Commission may have on the Nuclear Fuel Cycle Facility Status Report are our 4 Nuclear Fuel Cycle Program Directors who can introduce themselves when they come to speak. Similar to my CNSC colleagues in the regulation of the Nuclear Power Reactor Program, we are here to present CMD 20-M16, a special COVID update across the various nuclear fuel cycle industry sectors. This document was finalized on June 12, 2020, and in summary, I offer 3 main points. All nuclear fuel facility licensees have implemented their respective business continuity plans in response to the COVID-19 pandemic and are following public health directives and guidelines. CNSC staff continue to implement compliance activities using a risk-informed approach, and we have safety protocols in place for the gradual return of CNSC inspectors to site inspections. Finally, there are no safety significant issues to report, and CNSC staff confirm that licensees remain qualified to undertake operations according to their respective licensing basis. We are available to answer any questions the Commission may have. Thank you.
Thank you very much. I'll see if any of the licensees want to add anything or make a statement, starting with CNL, Ms. Williams. I don't see her there. Chemical, Mr. Mooney.
Good morning, it's Liam Mooney. Can you hear me?
Yes, we can.
Great. Thank you for this. I just wanted to start by echoing the comments from our colleagues with the nuclear power plants from earlier in the day, both in relation to our gratitude to those who have worked on the front lines of healthcare, as well as those who helped to keep us fed and warm throughout this crisis. We also recognize the contributions of our own workforce who have demonstrated their resilience every day since the pandemic began. We've actively monitored the situation and followed the guidance of relevant health authorities in the jurisdictions that we operate in. At Cameco, we began implementing protective measures on March 2nd, including activating our local business continuity plan and corporate business continuity plan, which includes our pandemic plan. We've increased the sanitation and cleaning frequency of our facilities, implemented site access and screening protocols, including taking temperatures, suspended non-essential work by visitors and contractors, changed our lunch break schedule to assist with social distancing, suspended all large group training, sanitizing workstations has become common practice. We have asked staff to work from home wherever possible and required physical distancing in the workplace consistent with occupational health and safety standards. Where that physical distancing cannot be maintained, personnel are required to wear the appropriate PPE, including respiratory protection. I also wanted to speak briefly about Cameco's work in the communities since the pandemic began, including establishing a COVID-19 relief fund in northern Saskatchewan that saw us donate $1 million to a number of community projects in Saskatchewan, as well as in Ontario, where we donated $250,000 into the Northumberland County and Algoma districts where we operate. In closing, Cameco and our staff have and continue to safely manage through the pandemic while complying with all regulatory requirements. We remain vigilant and continue to work closely with all our stakeholders and the relevant regulatory authorities. Our priority remains the protection of the health and safety of our workers, their families, and communities. Thank you very much for the opportunity to provide this perspective, and we're happy to answer any questions the Commission may have.
Thank you, Mr. Mooney. Let's turn over to SRB Technologies. Mr. Levesque.
Stefan Levesque for the record. Can you hear me?
Yes, though you may want to come a bit closer to the microphone if you can, please. Thank you.
Thank you. First, I'd like to thank members of the Commission, CNSC staff, and all other licensees, healthcare workers, and essential workers, everyone who's tried to work hard to keep the infrastructure going in Canada and for everybody. Being a private business like ours, it's been especially challenging for us, and also having to meet our obligations to provide emergency and safety lighting to a number of essential businesses like the aerospace industry, who needs their aircraft signs from us every day to be able to carry important supplies. Building maintenance facilities, including hospitals who need the signs to meet the code, basically, we've had to supply, and national defense. And meeting those obligations was most important for us to find ways to be able to best protect our staff, which is our greatest asset. We first increased the cleaning frequency in our facility, instituted a number of additional sanitizing stations. Staff who, this very early on, we did this in mid-March, staff who had traveled anywhere outside of the country were not allowed to return to work for a period of 21 days with pay. Anybody who exhibited any of the many symptoms of COVID were asked to stay home for a period of 14 days with pay. We promoted social distancing practices. Staff have been very supportive. We normally run 12 hours a day. We've expanded our shifts to 24 hours to be able to reduce the amount of staff on a given shift. We've also reduced very early on the number of staff per any work area, lunch area, eating period to 5, so that they would maintain well over the social distancing practices. Some of the employees are working entirely from home. Some are working from home on alternate days. Some are working in the mornings from home, some in the afternoon. We've secured PPE supplies and materials to ensure that we can continue to supply our essential customers. And very early on, we, like other licensees, started printing, because we have 3D printing capabilities, hundreds of face shields for the local community that we donated. But that wasn't near enough. There was a big shortage in our area anyway to be able to get face shields and other PPE like it. So we sat with local hospitals and members of local age homes and basically developed a plan to retool some of our facility to basically do a high production output of face shield with an injection molding machine that we have. So we invested in tooling with some help, some various community futures and the Ontario Together Fund. We applied for a license from Health Canada to actually make the face shields, which we got. And starting last week, we started producing 10,000 face shields a week, mainly to distribute in Renfrew County, but abroad. We've had already 50 large orders delivered to hospital, old age homes, and members of the public. So we're really proud of what we've been able to do during this difficult time. We've been lucky in our area where there's only right now 2 unresolved cases out of only having 25 in the entire area together. But, you know, we've taken everything seriously and feel for those who have been impacted a lot greater than we have been in this small community. So my heart goes out to everyone else. Thank you.
Thank you. McMaster University, Mr. Heisel?
Hello, it's Joe Zick here for the record for McMaster University. Chris is on the webinar, but for some reason not connected. So I'll get started and he can chime in if he gets connected. A few things to add in addition as far as an update for McMaster. We've implemented our business continuity plan. Essential staff have been on site and supporting operations. Similar to the nuclear power plants, you know, a number of things I'm not going to get into detail, but, you know, breaking up into teams, having essential staff only on site, a number of measures put in place to protect staff that are on site. I have to say we've had amazing support from not only our nuclear staff, but also security at McMaster and facility services when it comes to cleaning and support of our operations. So really good support from the university as a whole. We have been able to continue with all of our essential operations and have had no impact on safety. We've also had no impact on radiopharmaceutical production, which is very important for us as we are we are the sole supplier of I-125, which is a key cancer fighting treatment. Also, we've had some really good supply chain monitoring and haven't had any risks at this time to the materials that we need both for personnel safety and for essential operations. I also want to mention that as Canada's most research-intensive university, we've played a key role in virus isolation and research and development around treatment and developing a vaccine, and not only on the medical side, but also research and development for PPE, medical treatment equipment, testing of medical grade masks, and also starting research into the social impacts of this disease. So a number of areas that McMaster has been supporting. And I see that Chris has joined, and I'll let him add anything else that he may want to add for that. Thank you.
Good morning, ladies and gentlemen. Chris Heisel for the record. I think Joe covered everything that was pertinent to our things happening at the university. I'll just reiterate that our focus has been on the safety of workers and the safety of our operations, and we've I need to congratulate the staff who have stepped up, altered their work schedules, and have really embraced the whole idea of social distancing, good hygiene, and I think they've been champions in this area. So congratulations to the staff. Also the CNSC, I mean, we've had a lot of meetings with them virtually. We've been making progress on a lot of different items at the university and projects. So I think their flexibility and their willingness to change with the times has been very, very useful, and it should be recognized. Thank you.
Thank you. And lastly, we have Mr. Snowpack from BWXT.
Thank you and good morning, President Belshi and members of the Commission. My name is David Snowpack for the record. I'm the Director for Environmental Health and Safety and Regulatory Affairs for BWXT. Thank you for the opportunity to address the Commission on the matter of COVID. In mid-March, when the pandemic was developing in North America, BWXT immediately put in place continuity plans with the elements of personal distancing and safety, security of key supply, and planning for various contingencies. Under the heading of personal distancing and safety, our objective is and has been to minimize the population density at the sites and ensure safety of employees that are on site. To that end, non-essential personnel have been and are working from home. We are conducting screening of employees that are coming in. We split the shifts between day and afternoon and balance those shifts to further minimize the number of employees that are on site at any one time. We've staggered the start and end times of shifts to avoid congestion at the entrance and exit from the facility. We've also staggered breaks and meals to avoid congestion in those areas. We've limited suppliers and vendors to those that are essential only, and we screen those for any needing to come on site. We've of course implemented the 2-meter distancing policy, and we provided face coverings for our employees, and we've provided them in sufficient quantities for employees to bring home for family use as they venture out into the community to do their essential errands. We have significantly increased cleaning and disinfection for the facility. And at our larger sites, we've made main hallways directional and added traffic control mirrors to avoid congestion. Of course, we've also restricted travel. BWXT staff have been tremendously adaptable and flexible in this exceptional period and have been able to work very successfully both in the office and remotely for those that are working remotely. For security of supply, we've been working and continue to work with our vendors to ensure that we have adequate and supplemental key materials and supplies beyond the quantities normally held. We've been doing the same for security of supply for key services, or determining where contingencies are available and could be implemented if the need arise. For example, we're advancing certain infrequent calibrations of equipment scheduled in the fall, anticipating that there could be a potential second wave, perhaps associated with increased contact with return to school. We're planning for various contingencies, including a worsening situation or a second wave, but we're also planning for an improving situation, which would involve a staggered, staged, and controlled return to work for office employees. thank you. We are available for any questions that the Commission may have.
Thank you, and thank you all for your very informative updates.